Sorry, I thought I was last. I guess I'm not. Secretary Kennedy, thank you very much. His bold words tonight reflect a deep passion that he's expressed since very early in this administration, and it represents why HHS needs to be in the forefront of issues like this. The white paper that was crafted, it's several hundred pages long, but is actually a superb document, created a foundation for CMS, my agency, Medicare and Medicaid, to take bold action as well to address some of the challenges. But I want to take a second and outline where we are right now. There's an op-ed that Steph Carlton, my chief of staff, was over here somewhere, and I penned that just issued while we've been sitting here, and it highlights some of these issues. But of course, it all came out of the executive order of the president, protecting children from chemical and surgical mutilation. Simple title, descriptive and accurate in its desire to do just that. And today we will deliver that to the president and to the secretary. Many of you, as you walked through the front portal of this building, the Hubert Humphrey building, saw Senator Humphrey's quote on the side wall. And he speaks about the moral obligation of government to take care of those at the dawn of life, our children. 53% of children in America are in Medicaid or CHIP programs. So we provide insurance to most children, and commercial insurance follow us. But we are in a weird place in America where we have mixed politics and medicine. And do you know what you get when you mix politics and medicine? Politics. There is no medicine left. We witnessed that with bizarre statements, predatory actions, and many other activities that I think have forced children to the tip of the spear where they have brunt the burden of this toxic combination. We've been told that permanently altering bodies of children, and the children are told this as well, will bring them lasting peace. But few have achieved the inner peace promised by these charlatans, and the talking heads, the media personalities, the social media posts, all these have created a dishonest narrative. And of course, many of these children are left with the most tragic parts of all the treatments that they've succumbed themselves to. Many physicians as well have been pressured into compliance. The white paper outlines this, with the dangerous progressive ideology that treats children like lab mice. And because often in medical school you're taught to go along to get along, they have not been willing to rear their heads and bravely say what they know to be right, which is that these procedures are wrong. Individuals who question their sexuality are treated by medical professionals on the fast track, that's what it's called, approach to care, resulting in drastic interventions that merely increase the distress they're already suffering from. Under politicized medicine, people suffer long-term consequences. Let me go through the three major categories. Puberty blockers, reduce bone density, alter brain development, which is a real problem when you're 11, 12, 13 years of age, and disrupt sexual function for the rest of your life, oftentimes. Cross-sex hormones cause irreversible changes, including infertility, loss of sexual function, even cardiovascular issues, as well as long-term endocrine problems. And of course, the surgical interventions where you remove healthy organs, despicable and reprehensible as it is, permanently alter appearances and destroy children's lives. So let's talk a moment right now about the big question. This dangerous fast-track approach in invasive treatment, what it really does is slap a Band-Aid on a much deeper pathology, a much deeper problem, the underlying issue of gender dysphoria. It denies patients the opportunity to be seen for who they really are. The doctor can't look them in the eyes and treat them like a child that's confused and lost and needs help. They become an opportunity. They become eventually a victim. Reasonable evidence-based objections that a child's confusion might resolve over time have been ignored, even though it makes common sense, and it turns out from numerous studies now in Europe to be true. Again, we outlined these in the op-ed. And this is not how clinicians respond to the care of other pediatric issues, but it's how we respond to pediatric adolescent mental distress. And the medically honest approach is to at least start slowly, the least invasive possible, psychotherapy, counseling, including family counseling, evaluation of other conditions like ADHD and autism, and of course treatment of the anxiety and depression that so often is included with this diagnosis. There's lots of reasons we're having this problem. Social media is obviously a concern. There's been an explosion of discussions within children's groups about these topics. The surge has also been accompanied by healthcare professionals advocating that there's not going to be any opportunity to push a child to think twice about the decision they might have wandered into mistakenly in a whimsical moment. And 57% increase in suicide rates over the last great data we have, which is from the teens, is also a concern. with teenage children bearing the brunt of this. American taxpayers should not have to foot the bill for ideologically driven experiments on our nation's youth, and hospitals that we deem must meet the minimum quality standards of care and safety should not be conducting these experiments when we know so little about what is happening with our youth. Now the important part. For these reasons, and I can go on and on, this document, the white paper that the Secretary commissioned is over 300 pages long, we're taking major steps at CMS to stop a funding process that has led to irreversible medical interventions with two major actions. The first, we're announcing a notice of proposed rulemaking that ends taxpayer funding of sex-rejecting procedures for children in Medicaid and CHIP, full stop. We don't provide health care to every child, but at 53%, we've got most, and we're not going to let taxpayer money go to hurt these children, and those children will no longer be hurt with this ideology. We know that inflicting these procedures on young people costs them and the Medicaid system countless dollars, not just in medical bills, but also all kinds of downstream issues, while providers reap the rewards. Too many providers inappropriately profit from carrying out these destructive procedures, and I'm just going to go through this grotesque laundry list of prices just so you're on the same page with what Secretary Kennedy started teasing at. According to a 2022 JAMA data, so it's very recent, the typical vaginoplasty, a procedure a child does not need, costs $60,000. Shockingly, a phalloplasty, the creation of a penis, costs, on average, in America, according to this data, high quality, $150,000 per child. I do believe, with doing some work, that these prices have continued to increase with increasing manufactured demand. And I must point out that the creation of a vagina, in that case of a phalloplasty, or a scrotoplasty where you add testicles, that's extra. This is a pathology that has afflicted the medical profession. It is shameful that clinicians have profiteered off this. I do not understand how it could possibly have been tolerated by the leadership of these institutions, but it will no longer be funded. And I can tell you, if they're so diehard desirous of helping children and they don't get paid, the question is, will they do these procedures? And I think we know the answer. The second big thing, that's $250 million over the next decade of savings to the taxpayer, but that's irrelevant to this issue compared to the harm to the next generation, to our future, because kids are always our future. Second, to reinforce the need to protect our children, we are announcing that certified Medicare and Medicaid hospitals, pretty much everyone in the hospital in the country, will no longer be permitted to perform certain sex-rejecting procedures on children. Any hospital that does offer sex-rejecting procedures to vulnerable populations of pediatric-age kids will no longer be able to participate in the Medicare and Medicaid program. We want our hospitals returning to healing, not harming the patients entrusted with their care, or they're going to pay a very steep price. These actions are part of an all-government effort led by President Trump and spearheaded by Secretary Kennedy to protect vulnerable individuals and genuinely make America healthy again. This is not just smart, science-based health policy. It is our moral duty, as Senator Humphrey mentioned 50 years ago. I'm passionate about this issue. My whole team is passionate about this issue. Secretary Kennedy, God bless you for pushing forward on this.
Thank you, Dr. Oz. One of the most barbaric features of a society is the genital mutilation of its children. It's based on a medical dogma, sadly, that the normal, sometimes stressful experiences of boys and girls growing up is a pathology that requires medical intervention. Parents are told if they don't agree to these disfiguring and permanently sterilizing procedures, they're putting their child at increased risk of suicide, a baseless claim that has never been supported with good data. Let's be honest, and I'm going to say what you're not supposed to say. Pushing transgender ideology in children is predatory, it's wrong, and it needs to stop. This ideology is a belief system that some teachers, some pediatricians, and others are selling to children without their parents knowing sometimes, or with a deliberate attempt to remove parents from the decision-making. Puberty can be stressful, and for all of history, being a kid and interacting with kids from the opposite gender can be awkward, even confusing at times. But to see now a society putting kids on a path of chest binders, drugs, castration, mastectomies, and other procedures is a path that now many kids regret. And Chloe, I've got to say, your testimony in front of the Hill was one of the best descriptions I've heard on this issue ever. Maybe one of the best descriptions I've heard of any topic ever presented in front of Congress, and it's an honor to be here with you. Let me be clear about something, and this is an important distinction. Sometimes it doesn't get mentioned. We're not talking about medically treating kids with a biological basis for differences in sexual development, what used to be called intersex. We're not talking about children with 5-alpha reductase deficiency, Klinefelter syndrome, Turner syndrome, or other sex chromosome abnormalities. We're talking about an ideology that is supported by flawed science that every child as young as 4 years of age should pick from an array of genders. We've got high schools now where half the kids don't identify as a boy or girl. What's going on? To American hospitals and clinics, do not ask parents to leave the room in order to sell your transgender ideology to America's children. How is it that a child cannot get an ibuprofen without their parents' consent at school? Yet states like California are arguing that children should be able to make irreversible choices without their parents' knowledge. The UK actually did a comprehensive review in the Cass Commission of the medical literature and found there's no role for puberty blockers in many of these interventions. We as doctors have a duty to speak up, and that's why we're here, against this cruel practice. It's been hard to speak honestly on this topic. Many in academia who have challenged the dogma have been railroaded, dismissed, fired, or labeled in a form of modern-day McCarthyism. Just ask the former Brown University professor Lisa Lippman, whose research suggested that transgenderism was a socially contagious condition. Brown University persecuted her and did not renew her contract. And this is the story of many academics that are trying to speak common sense to this insanity. Let's stop with the labeling and let's have an honest conversation about what's best for America's children. Today, the FDA is taking action. We are sending warning letters to 12 manufacturers and retailers for illegal marketing of breast binders for children for the purposes of treating gender dysphoria. Breast binders are a Class 1 medical device with legitimate medical users, such as being used by women after breast cancer surgery. And these binders are not benign. Long-term usage has been associated with pain, compromised lung function from atelectasis collapse, and even difficulty breastfeeding later in life. The warning letters will formally notify the companies of their significant regulatory violations and require prompt corrective action. And I want to say thank you, President Trump, for signing the executive order to have us look into this. Thank you to Secretary Kennedy for speaking directly to this issue, to Mehmet Oz for finally ending government-funded sex transition procedures in the United States, to Jim O'Neill for his leadership, Brian Christine, Jay Bhattacharya, to Chloe for sharing her personal experience, To the entire team, to the many members here, Senators Marshall, Cassidy, Langford, Blackburn, you've taken risk and stood up on this topic and stood for what's right. Congressman Wahlberg, Anders, Adderholt, Harshberger, Crenshaw, AG Paxton. It's not easy to speak up on these issues, and you've done it at personal career risk. Thank you for speaking up for American children. It's time I can't tell you the number of people that said, don't talk about this issue publicly. You can talk about everything else in medicine, but do not ever talk about this on TV or in any public forum. You've probably gotten the same advice. But we're going to keep fighting for American children.
Good morning. I'm Admiral Brian Christine, the Assistant Secretary for Health at the Department of Health and Human Services, and I have the privilege of being the Senior Flag Officer in the Commission Corps of the United States Public Health Service. Welcome to you all, but especially welcome to you, Chloe. Today, we are taking decisive action to protect America's children from chemical and surgical mutilation and to restore evidence-based medicine and gold standard science to the forefront of federal health policy. What we found in our gender dysphoria review was truly alarming. From 2016 to 2019, the number of sex-rejecting procedures performed on children tripled. And despite the mounting evidence of harm and the reversals by European countries, the previous administration and my predecessor were driven by a warped ideology and a radical political agenda. And that is why I am signing this public health message today, to ensure that healthcare providers understand their responsibility to put children's health and safety first. As medical professionals, we have an ethical obligation to provide excellent care to our patients informed by the best evidence we have. And as such, we should refuse interventions that pose risks of unnecessary harm because our first mission is to do no harm. For the safety of our children, medical professionals should refuse to provide puberty blockers, cross-sex hormones, and surgical interventions. Instead, we must prioritize comprehensive psychosocial assessment and support. We must address co-occurring mental health conditions, and we must provide compassionate, developmentally appropriate counseling. And finally, we must educate young families about the incredibly weak evidence for these medical interventions. And let me be clear about this. This is not about politics. It is about science. It is about safety. It is about radical transparency. It is about trust. Our mission is to ensure that every American child receives medical care that is evidence-based, that is ethical, and worthy of the public's confidence. For America to be healthy and great again, we need strong, healthy boys and girls who will have the chance to know the joy of coming together as one and starting their own family one day. And if they are subjected to these vile, sex-rejecting procedures, that cannot happen. Protecting our children's health and their future is good medicine. Protecting our children's health and their future is our moral obligation. Today, I am offering the opportunity for every medical professional to absolutely reject harmful, irreversible procedures on minors and instead to prioritize medicine that puts the health of America's children first. All of us on this stage will continue to be guided by gold standard science, a dedication to radical transparency, and a commitment to truth. President Trump and Secretary Kennedy will stand for no less. Thank you all for being with us today. God bless President Donald Trump. God bless Secretary Robert F. Kennedy, Jr. God bless all of our vulnerable children who suffer from gender dysphoria and their families. God bless Chloe Cole, and God bless our republic. Thank you.